Congratulations, Mac. Well, that sound means it is day one of our Women's Health Week. Today, we're talking about ovarian cancer and what it takes to spot it and prevent it.
In our last hour, we talked to a cancer survivor on how she found out that she had the disease. Now we'll talk about how to treat that cancer and even prevent it. Michelle's here now with more on that. Michelle?
Thank you very much. I had the pleasure of talking with Dr. Stephen Buckley on Friday, who is Mary Othmer's doctor with her ovarian cancer, and he did the surgery, and he's been monitoring your chemo treatments and ever since. So welcome back, Mary.
Thank you.
And right now, Mary and I want to talk about prevention. Now, Dr. Buckley told me that for young women, prevention of oral contraceptives is one of the biggest factors that will lower the risk of ovarian cancer. Now, did you have oral contraceptives in your past?
I never used them because breast cancer runs in my family. My sister was diagnosed age 34. She's a survivor. She's in her 50s, and so I never wanted to take contraceptives because of that.
And there is a link between breast cancer and ovarian cancer.
There is a link, which I didn't know until after I was diagnosed with ovarian cancer, that there's a link between breast cancer and ovarian cancer. So if breast cancer runs in your family, you should be aware that there's a strong possibility of ovarian.
And that is news to me as well.
Right, and it was with me.
And with breast cancer, I mean, you can do self-checks.
Yes.
I mean, there are things that you can do as a woman to make sure that you don't have a tumor. With ovarian cancer, you don't have that ability to check your ovaries and your cervix and everything that is associated with the woman. So prevention, huge. If you're a young woman, you definitely want to check into oral contraceptives with your gynecologist.
Right.
I had an opportunity to talk to Dr. Buckley, and he gave us some more wonderful tips. Let's listen.
Probably the best thing that young women can do is oral contraceptive pills. In women who have used oral contraceptive pills for a period of time, their risk of developing the subsequent ovarian cancer is significantly reduced. The minority of ovarian cancers are truly what we call familial, meaning they're passed down from generation to one generation to the next.
Now, so does that have anything to do, like, let's say my mom had breast cancer, but I have ovarian cancer, are they linked?
They are linked, and there's a genetic link, BRCA, the gene, BRCA1 and BRCA2 are the breast cancer and ovarian cancer genes, and so patients who have defects or mutations in those genes, BRCA1 or BRCA2, are at a significantly increased risk, not only for breast cancer, but for ovarian cancer.
And all that it's just so frightening as a woman to know that these cancers, if you have them in your family, that you are at a greater risk. Right. And what can you do to help that? Well, Dr. Buckley in his office is having a luncheon. It's tomorrow, Tuesday the 29th, and it's called Teal Toes and Teenies. And Mary's toes are actually painted teal for this, and it's at 11 o'clock tomorrow morning until 2 p.m. The address is right there on the full screen on your screen. It's 915 West Monroe Street, Suite 300. It's at the La Villa building downtown. The phone number also on your screen, 389-3993 for more information. Mary, you're going to be there, aren't you?
I will be there, absolutely.
Are you guys going to be painting toes?
We're painting toes. We're having non-alcoholic teenies and some snacks and giveaways.
And it sounds like a great
It's going to be a good time.
It sounds like a lot of Dr. Buckley's patients are going to be there, and women who have ovarian cancer, because it is the silent killer. It's not very well talked about, and it kind of has it's very quiet.
It's a silent killer.
It is. So head on out if you have ovarian cancer or know anyone. So be sure to join us tomorrow, Phil. And
can we see Mary's toes here?
I know.
You got to see these toes. Mary's toes.
We're trying to get Sally to. There you go. Oh, there you go.
They are teal.
Teal toes.
Okay. Nice shoes.
Thank you.
Sounds like a song.
Mary, Michelle, thank you so much.
Thank you.
Thanks for telling your story.
Thank you very much. I appreciate
that.